Welcome to our discussion on Is it Tics, Stimming, or Tourette's? What parents need to know. I'm Dr. Inyang Takon, a consultant neurodevelopmental pediatrician hosted by Early Intervention Matters. Stimming, tics, and Tourette's are often confused. If you've seen your child flap hands or repeat sounds, this session will clarify these behaviors. We'll explore their meanings, differences, and next steps. Parents often wonder if behaviors like throat clearing or hand flapping are tics or stimming. These actions can be confusing, especially with misconceptions about Tourette's. A key question is control. Can the child stop the behavior? Understanding this helps differentiate between seeking attention and involuntary actions. Stimming and tics can appear similar, both involving repetitive movements or sounds. They often increase with fatigue, anxiety, or overstimulation. Tics are more prevalent in autistic children, and many with Tourette's also have attention deficit hyperactivity disorder. Stimming is common in autism, but also occurs in attention deficit hyperactivity disorder, sensory differences, and neurotypical children. Stimming involves self-stimulatory behaviors for comfort or focus, like hand flapping or humming. Tic disorder features sudden involuntary movements or sounds such as blinking or sniffing. Tourette syndrome includes multiple motor tics and at least one vocal tic persisting for over a year. The premonitory urge is a key clinical clue in distinguishing tics from stimming. Children often feel a tension or itch before a tic, which the tic relieves. In contrast, stimming is typically for comfort or focus, feeling pleasant rather than relieving pressure. This distinction is crucial for accurate diagnosis. Stimming can often be paused or redirected, especially when engaged in other activities. Tics, however, require effort to suppress and often result in a rebound effect. Over time, stims remain consistent, while tics, particularly in Tourette's, change in location and intensity, waxing and waning over weeks or months. Consider whether the behavior calms or focuses your child, indicating stimming, or if it appears suddenly without purpose, suggesting a tic. This is a practical guide for parents, not a diagnosis. A thorough assessment examines movements, triggers, timing, and accompanying factors. Clinicians assess tic disorders by duration and type. Provisional tic disorder involves tics present for less than a year. Persistent tic disorder features motor or vocal tics lasting over a year. Tourette syndrome includes multiple motor tics and at least one vocal tic for over a year. Parents need not memorize these details. Parents should know that getting the label right isn't necessary before seeking help. If tics are new, frequent, or distressing, an assessment is warranted. Suppression is exhausting, and not every tic needs treatment. Attention deficit hyperactivity disorder and obsessive compulsive disorder often accompany tics. Support involves acceptance and management, focusing on comfort and function. Comprehensive behavioral intervention for tics, CBIT, is the recommended first-line treatment for distressing tics. It helps children recognize premonitory urges and use competing responses. This evidence-based, non-medication approach enhances awareness and skills. Medication options are available if comprehensive behavioral intervention for tics alone is insufficient and should be discussed with a specialist. Stimming is purposeful and soothing, often seen in autism and attention deficit hyperactivity disorder. Tics and Tourette's are involuntary, urge-driven, and can be suppressed but rebound. Tics change over time, with a premonitory urge usually present, and are common in autism, attention deficit hyperactivity disorder, and obsessive compulsive disorder. Understanding these distinctions is crucial for effective support. Your child's understanding and support are paramount. Labels are secondary to ensuring comfort and functionality. If today's discussion resonated, consider seeking an assessment for clarity. Thank you for listening to Early Intervention Matters with Dr. Inyang Takon. Explore more insights on the Early Intervention Matters podcast. If concerned about your child's movements or sounds, consult your general practitioner or pediatrician. For a comprehensive assessment, request a referral to a consultant neurodevelopmental pediatrician. Access comprehensive behavioral intervention for tics therapist directories via national tic disorder organizations. For inquiries, contact Dr. Inyang Takon at eim@dartakon.com. The questions parents ask. Most my son keeps clearing his throat. Is that a tic, or is he doing it for attention? My daughter flaps her hands when excited. Is that stimming? Should I be worried? Does this mean my child has Tourette's? A word that carries heavy weight, often shaped by inaccurate TV portrayals. The question of control is one of the most useful threads for telling these things apart. Can they stop? Stimming and tics can look almost identical. Both are repetitive, involving movement or sound. Should I ask them to stop? Stimming self-stimulatory behavior is most common in autistic children, but also seen in ADHD, sensory differences, and neurotypical children. Both are repetitive, involving movement or sound. Your child deserves to feel understood and supported. 5 things. Every parent should know one. You don't need to get the label right too. Don't ask your child to just stop doing the tics 3. Not every tic needs treatment. 4. Watch out for other behavior difficulties your child may have. 5. Acceptance is part of the management.